All right, a very good afternoon. So we are from Group 8A and we're going to be presenting on home medication review. So as we can see here, this patient is 53 years old and he's pensioned with a BMI of 26.6, slightly overweight. So patient has recently admitted to the hospital due to his condition of unstable angina and diagnosed with chronic kidney disease. So as you can see this list of medication with the medical problem stated, where patient has a type 2 diabetes and is currently taking gliclazide, hyperlipidemia with atorvastatin calcium, hypertension with amlodipine and bisoprolol fumarate, unstable angina, patient is taking all these medications with GTN particularly as an emergency medication, and also gastric problem, patient is taking omeprazole. So as we can see here, patient is taking more than 5 medication and more than 12 doses of medication daily. So we can see a problem here of polypharmacy and hence lead to a risk of non-adherence, where we increase the drug burden in this patient, where the patient's blood pressure is not controlled properly but due to the non-adherence. Next patient also might have possible drug-drug interaction, where with this multiple medication increasing the risk of side effect experience. Next, we also see the need to review the medication with the physicians, where patient is taking multiple medication for a single indication itself, which is unstable angina. So as you can see, this medication, particular trimetazidine dihydrochloride, where it's not listed in the CPG of unstable angina, and it also increases the risk of fall and movement disorder and hence not recommended, and should be tailored to maximize the patient's compliance and to minimize the side effects.
Okay, continuing with more drug-related problems, the patient just recently bought a herbal medication from bomoh, which is recommended by his friend. This leads to drug-related problems such as drug-herbal interaction, where the herbal medication came from an unregistered or harmful unknown source. Next, when the patient takes the herbal medication, it changes the perspective of the patient on modern pharmacological treatment, and thus the patient tends to reduce dose by himself, and patient can also skip taking medication at times as indicated by the physician. Next, possible inappropriate method of taking medication. For example, patient is taking GTN for his heart problem. For GTN, patient should receive and understand correct instruction on how to use GTN so that the medication is effective for him. Next, as the patient also takes more than 12 doses a day, it also leads to high possibility in incorrect timing, method, and indication, as patient might be confused. The patient also was recently diagnosed with CKD, and there is also drug interaction with his current renal profile. With CKD, the dose of medication should be tailored according to patient's renal function, and medications that can affect renal profile should be assessed. Continuing, inappropriate management of hypertension. In hypertensive patients with high severe risk with CKD, it is recommended to change to combination therapy, either ACE inhibitor with CCB, as it can reduce albuminuria and slow the progression of kidney disease, or change to CCB plus thiazide like diuretics combination for better control of blood pressure to the target, which is 130/80. Apart from that, the use of beta blocker for his hypertension. The patient is currently taking bisoprolol fumarate for his hypertension. Beta blocker has the potential to mask symptoms of hypoglycemia in diabetic patients. Thus, in diabetic patients, beta blocker should be used cautiously. As the patient has complex medication regimen, the patient may experience side effects such as myalgia with his high-intensity statin therapy. Lastly, the concurrent use of cardipine and clopidogrel has high risk of bleeding in elderly. However, as suggested by the 2014 AHA-ACC guideline, combination of aspirin and clopidogrel daily should be continued for at least 1 month, and ideally up to 9 to 12 months after UA is treated medically.
Okay, next, to solve the drug-related problem, we have come up with some intervention plans. Firstly, we plan to educate the patient on the names of each medication and its indication. Explain to the patient about the difference between the traditional and modern medication, emphasize on the importance of taking the medication from the doctor, then counsel on proper management and storage of the medication. Secondly, we plan to give referral letter to the patient doctors to change, stop, or to adjust the dose of some special medication. So then suggest to the doctor to alter treatment for hypertension by add ACE inhibitor or ARB as it has proteinuria effect and also renal protective. As to organize patient medication, we will prepare medication charts in order to prevent errors and patient confusion. We recommend to the patient to use pill box, and if the patient has smartphone, suggest him to download P-Remedy application as alarm to help seize them in medication intakes. Next, we also plan to prepare daily medication schedule. Okay, this medication schedule consists of medication information such as name, the strength, the indication of each medication, and when to take the medication, either is after food or before food, whether it's on morning, afternoons, or night, and when needed. This is to ensure patient take medication properly and correctly at the right time, right dose, and right frequency.
For the fifth intervention plan, a patient should have lifestyle modification. It's suggested to have appropriate diet. He should consume the low sodium, sugary, spicy, and processed food. He is also suggested to do physical activity for at least 150 minutes per week. Next, she should be advised on the traditional medicines from bomoh because it could be unregistered medication and the manufacturing process might be not follow the GMP. And they might also know clinical trials to make sure the safety of taking it. Thus, he should be advised to inform or ask his physician before taking the traditional medicines. He could bring along all of his medications if he cannot remember the name of the medications. Moving on, patients should be advised to do self-monitoring of glucose levels and blood pressure at home regularly. If he does not have any device at home, he can go to the nearby community pharmacy or health facility to measure it. Next, he should be instructed on how to use GDN. Firstly, use only when necessary and place the tablet under his tongue or between the cheek and gum. Do not chew or crush or swallow the tablet. And if the first tablet does not work, take another tablet after 5 minutes. If the chest pain continues for 15 minutes, despite of 2 tablets had been taken, call the ambulance immediately. Next, so our choice of intervention is to organize patients' medication according to its indication. The reason is to avoid patients' confusion due to the multiple complex regimen.
Alright, as you can see here, we have a medication box listed with the medication and indication. So the first one we have here is high blood pressure. So it's written with the medication name and direction of use with medication 1 and 2 clearly labeled. Next, we have anti-diabetic drug and also drug for hyperlipidemia. So it's on the other side where it's listed cholesterol. So beside each indication, we have the moon and the sun indicating pagi and malam. So next we have drugs for sakit jantung, which is for unstable angina for this patient. We have 4 different drugs listed, and we have a list of the drug with the indication as well in the box. Alright, next, moving on, we have the drug for gastric and also angina attack. So, yep, here we have it, medication box with indication and direction of use.
So moving on monitoring plan, firstly for your diabetes, on post-visit to patient homes, we can carry out random blood glucose tests to patient in making sure the blood glucose is under control. We also can advise patients to do regular blood glucose tests for random blood glucose or fasting blood glucose to the nearest pharmacy or clinic. We can ask patient if he usually feeling thirsty, frequent urination as it is a sign of high sugar in the blood. For the side effect of the medication, we need to monitor the symptoms of hypoglycemia such as sweating, dizziness, feeling hunger, advise patient to immediately take sweet food or drink. So for the hypertension, we can monitor his blood pressure on the post-visit. The ideal blood pressure range for this patient is below 130/80 mmHg. Ask patient if he's always having severe headache, fatigue, or vision problem, as it is a sign that his hypertension is not controlled. As patient taking amlodipine, look if there is sign of swelling of legs or ankle. Monitor sign for hypotension such as dizziness or fainting. Advise patient to lay down immediately and take a rest. For hyperlipidemia, we need to advise patient to do regular repeat profile checking on the nearest pharmacy or clinic. As most patients will not experience usual symptoms of hyperlipidemia, we need to alert patient for the symptoms such as shortness of breath, chest pain, as it is a risk factor for cardiovascular disease. As patient taking high-intensity second therapy, monitor if patient having undesirable side effects such as muscle pain. We can advise patient to seek for the doctor to lower the statin intensity therapy if he cannot tolerate to it. So for the gastric problem, monitor if patient still having the abdominal bloating or pain. As patient is on long-term use of omeprazole, monitor for any sign of gut infection or vitamin B12 deficiency. So for the unstable angina, we need to monitor the heart rate and cholesterol level. Ask patient if he experience chest pain, usually on the left side. As patient taking aspirin and clopidogrel, monitor for the sign of bleeding. Ask patient if he experience gum bleeding, nose bleeding, or blood in the stool. Lastly, for the chronic kidney disease, advise patient to go for the scheduled visit at hospital to do blood tests for monitor for serum creatinine, urea, GFR, albumin level, and electrolyte level. As patient did not end on any medication and just diagnosed with CKD, alert patient if he experiences symptoms like swollen ankle, blood in the urine, itchy skin, weight loss, or increased urination. As it is, if he experiences this, he need to seek doctor immediately. And last but not least, we need to assess back patient knowledge, perception, and adherence towards his current medication, treatment, and clinical condition. And that's all from us. Thank you.